Hello, my name is Dr. Philip Miller. I have a facial plastic surgery practice in New York City. I specialize in rhinoplasty. And this morning I'd like to discuss the role or effect of thick skin and thin skin on rhinoplasty. Now, thin skin allows you to see a lot of detail. You get a very defined tip. Thick skin will unfortunately not be able to reveal the fine structures beneath the skin and provide a very defined tip. And I have an example for you over here. This is the model that I have and I showed during my consultation. It has a little bump here so that I can convey to patients what it looks like under the skin, and obviously that would come down. But I want you to focus right here on the tip. This is a very, very narrow, defined tip. And this purple elastic is representative of someone who has very, very thin skin. And if you take a look, if we have thin skin over the nasal tip, then you can get very nice definition. And the thinner the skin, the more contraction, the more the skin contracts. So when I talk about swelling, it's sort of this purple elastic being very swollen, and then as time goes on, you'll notice that this skin gets more and more contracted over time, and you get to have a really nice defined tip. If it contracts too much, then you can get a pointed tip, and that's why it's important to treat the very, very thin skin patients with other maneuvers to prevent this. Just as much as you can get a nice defined tip, let's take a look at what happens with very thick skin. As you can automatically figure out what happens here, but these gauzes represent very thick skin, and no matter what you do, you'll just never get the kind of definition that you will get with thin skin. So there are limitations in rhinoplasty. Unfortunately, I won't be able to give everybody exactly what they want if they have thick skin, and there are limitations even with thin skin on exactly what can be done, or other maneuvers have to be employed in order to make sure that the thin skin patient doesn't contract too much around the underlying cartilages and give some irregularities.